Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Register before June 20th and receive 15% off seating. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
You're listening to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We're sitting here in the studio bringing you some very interesting information. Actually, we are in Orlando, Florida at the International College of Applied Kinesiology annual meeting with some of the most brilliant minds that I've had the privilege of working with and using as consultation and backup. These guys are amazing. It's a group of people, whether they're chiropractors, acupuncturists, dentists, and so forth, have the primary interest of applied kinesiology, which is, many of you know, is a specialty in my practice. And we're going to kind of spin off a topic that was presented over the last couple of days, only one of many. My guest on the program today, somebody that is very familiar to all of you, Sue Roselle. And because we're going to be talking about chemical dysbiosis or imbalances within the intestinal tract and how that works, how that affects your health and so forth. If you've had a problem and you've tried and you applied, particularly if it's something that has to do with an unknown, meaning you're hurt all over, inflammatory reactions, and there's just pain that just doesn't go away or other dysfunction, this may be an opportunity for you to really understand that. If you have any questions on today's program, unfortunately we're not going to be able to take them, but you can always call us at 703-698-7117. That's 703-698-7117. Or go online at rosellecare.com. That's ROSELLECARE.com. rosellecare.com. And tomorrow on Monday we will be home. We will be back in the studio, and glad to take your phone calls and get information back to you. But my guest, Sue Roselle. Hi, Sue.
Hi.
You've got a chance to listen to some of these incredible people the last couple of days.
Amazing brains here.
There's some local people. Our staff, one of our doctors, Dr. Howland Browning, is here. There's an MD from Gaithersburg who's joined us, and Dr. Alan Vinitsky, who is actually one of the presenters. I'll be lecturing tomorrow afternoon. I was hoping that Dr. Evan Mladenoff would be part of our presentation today, but Evan is going to be presenting in about 45 minutes, 50 minutes. And when I'm done with this broadcast, I'm going to hurry up and go down and listen to him because he's always phenomenal and top shelf.
Absolutely.
But so let's talk a little bit about what happens when things just don't clear up in the intestinal tract. Let's talk about that dysbiosis, that imbalance that causes inflammatory response, that causes chronic disease patterns, that causes things that just don't go away. You listened to an interesting presentation with a very good friend of mine yesterday, I think, Dr. Michael Leibowitz from Grand Junction, Colorado, and Michael is an incredible intellect when it comes to understanding these pathways. But what was your take on it?
Well, first of all, 4 hours just flew by. I couldn't believe we sat there for 4 hours on this particular presentation. Basically, if you have to sum it up, you go back to what the old healers have said from the very beginning, that life or death begins in the colon. And we just are going to expand a little bit beyond the colon to include the small intestine as well. In other words, if you cannot get things into your body that are useful, and you cannot get rid of things from your body that are not useful or are toxic or poisonous, your body is going to start to fail. No matter what other things are going on in your system, that is the root of I would say majority of most functional illnesses that we that we see a lot in our practice.
Once the intestinal tract is broken down, it doesn't make any difference how good you are after that, how many good vitamins you put in, how much good food you put in.
Right.
When that gut is dead and the supporting factors are no longer there, the system has no opportunity to resolve itself.
That's right. If the good stuff doesn't get in and the bad stuff doesn't go out, you got trouble, no matter what. And it just manifests itself in so many different ways. It can be in allergies. It can be in autoimmune problems like rheumatoid arthritis or lupus or thyroiditis. It can be skin problems, eczema, psoriasis, just random skin rashes that nobody really knows what they are.
Well, the interesting thing is that most people don't understand that the majority of the immune process actually starts in the intestinal tract.
That's right. And for good reason. Our first line of defense is our immune system that picks up bad guys that have come in. And, of course, historically, from the beginning of time, our biggest exposure to bad guys, parasites and funguses and bacteria and viruses and so forth, have been through food and water we've ingested. And that continues today.
It's food and water. It's the stuff that they spray on our foods, the stuff that comes in, and even external pollutions and electromagnetic fields, cell phones. We know that destroys the functional capacity, but it also breaks down tissue. It reverses DNA, shortens what we call the telomere, which gives you your life and your vibrancy and all the codes that your body needs to work at high levels. It's a constant insult, and unfortunately, those of us live in metropolitan Washington have a much more difficult time changing some of these things. But the cancer patients that we see, the patients with profound allergies, anaphylaxis, if you will, seizure patterns, the simple things of GERD, gastroesophageal reflux disease, the body's inability to function properly starts in that intestinal lining, and it's not a matter of throwing another drug on it, because basically what you're doing is you're taking a can of kerosene and throwing it on the fire.
Right. And interestingly, how many cases do we see of GERD that correct themselves when we start fixing their gut? And we haven't even talked about their stomach.
No, not at all. In all of these things, the International College of Applied Kinesiology is about answering the question, why is that? And as we've talked about it so many times, it goes back to the metaphor of the triad of health, the structural, chemical, emotional pathways. Right. And all of these things are involved in what we're talking about. And the nerves from the spine go to the intestinal tract, the emotional stresses go to the intestinal tract, the biochemical imbalances go to the intestinal tract, and you see different symptom presentations, no matter whether it's an ileocecal valve problem, which is the lower part of the intestinal tract that allows food, once digested from the small intestine, go into the colon to be eliminated. If it's irritable bowel disease of any kind, you name it, and it doesn't matter. The product that is the description of the symptom is really going back to the same causative factors.
Exactly. And when we talk about the intestinal tract, you have to remember there's two major portions of it. There's the small intestine, which is actually the longest part of it, anywhere from, I believe it's 21 to 25 feet in most adults. And then it's connected to the large intestine by that valve you just mentioned, the ileocecal valve or the ICV. It's a small sphincter-like muscle that connects the two parts of the intestinal tract and kind of regulates the flow. It's a stoplight, so to speak. Then the large intestine makes up the remainder, and that's about 3 to 3.5 feet, actually. Most all of the digestion that occurs and absorption of nutrients going into our bodies, and unfortunately the bad stuff as well, occurs in the small intestine, because that's where the villi are, and that's its primary purpose, is to do final stage digestion through a variety of different enzymes and substances that are given off by the pancreas, the gallbladder, and the intestinal lining to break our foods down. And finally, once they have been broken down, hopefully completely, then the villi of the small intestine absorb these products into our body, goes into the bloodstream, most of which circulates through the liver and is sorted out and sent off to all the
But if there's no villi, it doesn't work.
But when the villi are not there, or they're broken, or they're damaged, we don't get absorption. It's called malabsorption.
Well, we got a situation where a lot of patients will say, I take these nutrients, I take these vitamins, they're not doing me any good. Well, most of the stuff that we see anyway is garbage vitamins. They're not organic and they're synthetic and they're extracted from the things. But even when you take good whole food nutrients where they should work, or you're taking things like vitamin B12, or you're trying to get folic acid. B12, for example, absorbs at the distal portion of the small intestine. But if that intestinal tract, that small intestine, is already inflamed and broken down, and these little receptor surfaces, these hair-like elements that project from the colon called villi, are damaged, broken, suppressed, can't repair themselves, you're not going to get any absorption because there's no surface area for it to absorb in, and you've got a thickening and irritation and inflammatory area that nothing gets through, leading to the end product is chronic disease because of the inflammatory pathways that begin to become chronic within the system.
Right. And probably the most obvious thing that we hear the most about right now about damage to the villi is when someone actually has the disorder called celiac sprue, which is the disease portion of people who are extraordinarily sensitive or allergic to gluten. The reason it is such a damaging thing, and not everybody that has a gluten sensitivity is going to have this, and I have to make that point. It's only a very small portion that actually has the disease.
It's an erosion of the gut.
It actually breaks those villi down and damages them to the extent that there's no longer sufficient surfaces for good absorption of nutrients.
You know, the interesting thing about sprue and some of the other degenerative diseases that take place in the body, traditional, typical allopathic physicians will tell you that once that's happened, you're done. It's irreversible. You have to have things removed, and they cut part of the bowel out sometimes, or they hit you with steroids that starts destroying the rest of the body. But so much of these end conditions are reversible, even to the point of having a celiac patient, to the point, and going back to what you're saying about gluten sensitivity, even though the patient, and all patients don't end up with celiac, when you have a profound gluten problem, until that is cleaned up, until the body's desensitized, until you begin to restore, and we're going to talk about inflammation, methylation pathways, these conditions are just as profound on the body and the diseases and other conditions that they occur outside the gut.
Right. And a lot of times we have people who have sensitivities to lots of different foods, and we say you have to not eat these for right now until the body heals. Well, one of the reasons is it irritates the lining of the intestinal tract. And just like the nose, when it's irritated by pollen, the tissue swells, it creates a lot of mucus, you can't smell very well, you can't breathe through your nose. Well, a similar thing happens to the intestinal tract, except the mucus that forms there covers over the villi. It makes it difficult to absorb things. We get swelling in that small intestinal tract, so you get bloating and you get pain and gas, and in some cases diarrhea, other cases you get constipation. You can get nausea. Those are typical symptoms of small intestines that are irritated by substances, and generally that is due to food allergies or eating foods that are just irritating, like really, really hot, spicy food a lot, or too much caffeine, or too much refined sugars and so forth that cause irritation and inflammation. Alcohol is another one. They cause an over-secretion of the mucus and swelling and inflammation, and you just end up not getting the nutrients into your body.
Well, here the other thing that that we overlook often when we think is just about food and dietary patterns that go into the system that will break the colon down, and break the rest of the body down as well. But there's this little thing called sympathetic stress. It's, it's when the body goes into fight-flight reaction.
Absolutely.
The sympathetic nervous system is there to protect the body. It's there to put circulation into the muscles, to allow you to run faster or lift a car off a child, or in the extreme situation.
Right.
But when we're constantly being stressed by our environment, by our dietary patterns, this sympathetic nervous system just goes crazy.
Dr. Tom Roselle, live on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are broadcasting live from Orlando, Florida at the International College of Applied Kinesiology annual meeting, a think tank that goes beyond description. Amazing people from all over the place, some of the most incredibly intelligent people that I have had the pleasure of associating for many years. If you want to get a hold of us, if you would like to re-listen to this program, it's real easy to do. All you have to do is go to RoselleRadio.com, and everything that we do is there. Also, go to WMAL.com and hit On Demand, so you have two sources of getting that done. The broadcast today is very, very special in that it kind of is a lead-in, Sue, to what we're going to be doing in September 17th, as a matter of fact. Ageless Health 2011 is our annual...
Our big event.
Our annual presentation. And so much of what we're observing today are things that we've already got planned for this coming fall's presentation. We want to encourage you. You have up until June the 20th to take advantage of a very, very special discount rate. You can do that by going online at RoselleCare.com. That's RoselleCare.com. Click the button that says Ageless Health. There's a whole description of the seminar sitting right in front of you. And register. But you have until the 20th. Don't let that go by, and save yourself 15%. And because this is a program, as you know, that always sells out, and we don't want to tell you no. So do that today. Give us a call at the office at 703-698-7117, or go online to register at RoselleCare.com. Sue, let's talk a little bit more about this. I know you wanted to talk a little bit about a problem that is really not addressed very well.
Well, one of the things before we leave the information about the small intestine is, and it's a problem that a lot of people are concerned about if they have digestive issues at the stomach level, GERD and so forth, is a little bacteria called Helicobacter pylori, or H. pylori. It's a bacteria that's unusual in that it can survive through the stomach acid and burrows into the tissues of the stomach, generally at the bottom of the stomach where it connects into the duodenal area, or the top part of the small intestine. And about 85% of ulcers are caused by
all duodenal ulcers,
the dirty work these little creatures create. Now, we all have a small amount of it, and it doesn't cause ulcers in everybody, but when you get an overgrowth, an excessive amount, and you have the right conditions, these little guys can really create havoc and end up with people having severe ulcers.
And a lot of the problems that physicians will tell patients that they have with GERD are not GERD at all.
It's the H.
And that's
pylori.
A whole different situation as well, but it's an H. pylori problem.
Exactly. And interestingly, a lot of people say, well, where do I get this bacteria from? It's found in poultry and eggs. So we go back to the fact that undercooked foods can often be very detrimental. And I know that long ago, the best breakfast in the world was a raw egg blended in some form of liquid, and
that's
not a safe thing.
Yeah, my grandma used to do 2 raw eggs and a glass of wine.
Yeah.
And she said it was good for your blood.
No, it's not.
Yeah, I know.
Really bad for your stomach. But undercooked poultry and undercooked eggs are one of the major reasons you can pick up an H. pylori infection. Traditional medicine goes after it with heavy-duty antibiotic therapies. Well, it may get rid of the H. pylori. It may not. They don't always go back and retest. But the problem is it causes problems further downstream in that the high-dose antibiotics start messing with the floras in the small and large intestines. And so even though you may get rid of the H. pylori, you're creating other things. There truly are some things that can be used that will eliminate that H. pylori without the use of heavy-duty antibiotics.
And that's the most important thing. People, go to their doctors, and even the ones that are appreciative of the fact that H. pylori can cause the damage that it does. The next step is to put them on these massive dosages of antibiotics, which causes another problem that you're going to spend months of recovering from.
Exactly. So there's options, and that's the important thing.
Well, we're going to follow this through.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live, and we are broadcasting live from Orlando, Florida at the International College of Applied Kinesiology annual meeting, a think tank that is amazing, and some of these guys are just so humbling. And when I listen to them, I mean, humbling, I'm the one that's humbled. It's, it's like, wow, where do they come up with this information? But it's something that we can apply in our everyday practice. And, tomorrow I present, and it's like, do I really want to get up in front of all these guys? I'm going to be on stage for an hour tomorrow, and I've got to talk to some of the most brilliant people that I think exist on the planet, and I'm saying, oh my God.
Oh, they'll say the same thing about you.
Yeah, maybe. But we'll see. Anyway, my guest, obviously, Sue Roselle, and we're listening to some very wonderful information. I'm going to have another dear friend, Dr. Evan Mladenoff, later on, meaning the next couple of weeks. He was unable to be on the program today because he's presenting in about 15 minutes, and he's, like me, a little nervous, and he's, got to get his head together. So, and when I'm done with here, I'm going to go listen to Evan. Dr. Tom Roselle Live is, as always, very thankful of our sponsors, and one of our ongoing sponsors is Thermography Centers of Fairfax. And we've told you, we've encouraged you, we've prodded you to include thermographic imaging as part of your ongoing health evaluation. It's non-invasive, and it can pick up things long before they show up in any other type of diagnostic mode. If you have pain, if you got a lump someplace, this is something that you want to incorporate. Call Thermography Centers of Fairfax. Ask Dareth Painter to schedule an appointment for you, to send you information. The number is 703-943-7248. That's 703-943-7248. Sue, let's get a little bit more in depth on some of these subjects. I know there's an area that you want to hit, and let's talk about that.
Okay. Well, pretty much at this point, things that can be done with the small intestine that are immediate are, if you know something upsets you when you eat it, don't eat it. That's the first thing.
Gee,
keep a log of things that bother you. And usually you have to write these down because most of us can't remember what we ate for breakfast yesterday morning, much less what bothered us.
What's that commercial, Pepsid or something like that? They say, you can take this first and go eat your...
And go eat anything you want to.
Yeah.
Not a good idea.
Not so much.
Not a good idea.
Fifth Avenue marketing at its best.
Yeah.
Okay.
Most of us are going to have some negative impact when we eat really hot, spicy food or really greasy food or really refined foods. And that just goes back to the junk food. Cut the junk food out. Be careful about how much alcohol. Cut the caffeine, the carbonated beverages. Chocolate, to most of us, is a treat, and it should be in very small amounts. But for some of us, it can really be damaging to our digestive tract.
And if you crave it, you're allergic to it.
That's true. And then make sure that you're getting a lot of good foods, the raw fruits, the vegetables, or lightly cooked vegetables if the raw foods don't appeal to you. The whole grains, if you're having grain in your diet. And if you're a gluten-sensitive person, make sure they're not the gluten-containing grains. The good lean meats, the free-range, the organic ones as much as possible. But in other words, the core of your diet has to be the good, supportive foods that give our bodies the nutrients that we need.
Here's an interesting add-on to that. You talk about if you're allergic to something or you have sensitivity to it, don't eat it. We can desensitize so many different food sources and environmental allergens and so forth. The problem exists this way. Patient starts feeling better, said, oh my God, I can start eating this stuff again. Mm-hmm. And the first couple of times there's not an issue. Pretty soon they begin to develop a more significant reaction. So the deal is this. Can the body turn something around permanently? The short answer is yes. The complicated answer is you still have to stay away from things on a chronic basis, even when you're desensitized, until your genetic markers, your DNA code reverses itself, and that can take a year or 2 or 3. Right. You can get away with it. You won't have the reactions initially, but if you go back and do the same old again, the underlying predisposition is still there. You give your body a chance and you continue the process, the body does change.
That's right. That's right. And the other thing is relaxation, getting enough sleep. Deep breathing. Do something that relaxes you, that gets you out of that fight or flight syndrome. For some people it's yoga, for some people it's meditation or prayer or reading or just deep breathing exercises or Pilates or something. But get out of the stress mode some point every day so that you start ramping that stress response down, because it definitely does have an impact on the digestion, especially the intestinal tract.
And digestive function is where health starts. And if we don't get that thing cleared up, it was an interesting presentation today. Matter of fact, Dr. Alan Vinitsky was bringing it out. He was talking about some patients that were chronically constipated. And this was a young child. Mm-hmm. And we do something called a vitamin C or ascorbic acid flush in our practice, where we take away the inflammatory response from the intestinal tract. So he started this one young patient on what, I think everybody in the room said, oh my God, you didn't put a child on that kind of vitamin C. But they started out putting that child on 10 grams, 10,000 milligrams of vitamin C, then 30, then 50, then 60, then 70, and the child still didn't have a bowel movement. It was still constipated. Not until they got the levels up to 130 grams or 130,000 milligrams of vitamin C did the child begin to have bowel movements.
I know.
And when you see that type of chronic constipation, then you're dealing with a problem of heavy metal toxicity. And that's something that is unfortunately in our environment. The fish that we eat, so many different sources, the air that we're breathing in because of the pollutions that come in from other areas, and we end up I even forgot dental work, Mm-hmm. It's all there.
Well, an interesting thing on the fish thing, at one of the presentations, if there is a teaspoon of mercury added to a 22-acre lake, it renders the fish that are in that lake inedible.
Yeah, you can't touch them.
A teaspoon of mercury.
That's right.
So that tells you how serious this whole mercury thing is.
Well, it's not only that. When somebody puts a mercury filling in your mouth, and if they go back 6 months later, over 25 to 30% of the mercury is gone from the filling, guess where it went?
Right.
In you.
Mm-hmm.
And, you have to be able to find it. The other interesting thing that I found out today, which I didn't know, is that when you run a mercury marker and the mercury level is deficient, meaning it's not there, it's low level, and there's other amino acid levels that have elevated, what it actually means is that the body is holding on to the mercury, and you're actually mercury toxic.
That's right. Interesting.
Would have never thought about that.
Well, if we move on down to the large intestine from the small.
We're traveling.
We're traveling. Moving on down.
Hand in hand.
The large intestine is an interesting part of our organ system in that its primary job is to absorb. Again, it absorbs anything that's there. So primarily it's to reabsorb most of the water. It takes more than a quart of water into the small intestine to mix with the fluids to make good digestive function happen, and then the large intestine reabsorbs at least a third to a half of that. However, the things that are dissolved in that water are also going to get reabsorbed. So that's a good time for a lot of the chemicals and a lot of the toxins that are created during our final stages of digestion to be reabsorbed. Again, the cleaner your small intestine is, the less toxic material you create, the less problems you're going to have in the large intestine reabsorbing.
We have so many patients that come in and say, listen, I want to clean out. I want to do a detox program. And I said, great. Got 6 months? And they said, no, I want to do it in can't I do it in a week and clean? Mm-hmm. Well, is your gut normally clean now, and you're just kind of pushing things through and flushing it out like cleaning the swimming pool out? And what people don't understand is that when you really start to detox, first of all, it has to be slow and gentle. Mm-hmm. And then you can step it up over a period of time, but you have to make sure that you go the distance. Otherwise, if you don't clear the gut, and if you don't handle liver function, and you don't handle the lymphatic system, you re-pollute yourself, because this stuff starts flowing back into the system, not only through the intestinal tract, but then through the bloodstream and so forth. And then your liver's got to handle it, mm-hmm. and you back up all the liver functions.
And interestingly, some of those things that can happen are increased cholesterol, cystitis or urinary tract infections, gallstones, appendicitis, possibility kidney stones as well, and kidney infections. Yeah. And that's because the gut's not working. I
have a patient that has been in our office probably about 9 months ago or so. I forget the time frame, but I'm actually dealing with her now by computer and overseas because she lives in Greece. And she has a chronic cystitis mm-hmm. that just won't go away, and she's been hammered with every form of antibiotics and every form of antimicrobial that I think that exists, and with no resolutions, it's getting progressively worse. And I told her, I said, listen, this is what you have to do. And I said, none of that stuff is going to work because it's not that. It's probably one of a couple things, and it's either a toxic reaction in your body or you have high levels of mold and fungus. And we're taking her off of things, and she's getting better. And all of a sudden, 10 days into this thing, where she's starting to get some changes and so forth, well, she said, well, can I eat any kind of bread, or can I have anything that is sweet in my diet? And I wrote back and just on the computer one word, no.
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 You're no fun.
not if you want to heal up and do really well. I mean, it's kind of tough. I can't even test her, but she's going to have to follow the protocol. The bottom line, the only reason I bring it up is that if someone is willing to really make the difference and change the things that are around them and the things that go into them, they can change everything.
That's right. And, of course, one of the big things that we talk about with the large intestine is the kind of flora that we have there. We have lots of different really good bacteria, about 400 different species, or about 4 to 5 pounds of bacteria that inhabit our intestinal tract, the majority of which are in our large intestine. They provide us with lots of valuable things. Certain of the B vitamins, B1, B2, B12, although we don't really absorb it very well, vitamin K, which is our traffic cop for calcium metabolism and also clotting processes.
Well, they also produce something called short-chain fatty acids,
absolutely,
which are the things that actually protect the intestinal lining and help fend off all kinds of things.
That's right.
And if those short-chain fatty acids, particularly something called butyrate, is not at good enough levels, you're not going to heal anything.
Well, and interestingly, I say, if you're on a high-fiber diet, you're going to have a large quantity of lactobacillus, which is a good guy. That's what makes yogurt. And certain forms of healthy streptococcus. Not all streptococcus is bad stuff. If you're on the low-fiber diet, the E. coli proliferates. And again, if you're also on a refined carbohydrate intake, that's the white flour, white sugar, white junk, trans fats, the usual junk food that people consume, those particular bacteria can add to cystitis, the urinary tract infection, appendicitis, gallbladder problems. Ladies, especially postmenopause ladies, listen up to that one. And taking antibiotics is going to make that bacterial flora problem even worse.
Yeah, there's an interesting piece, too, that a lot of physicians don't get and psychiatrists and psychologists don't get. The majority of the patients that walk into their office that suffer from chronic depression is because their gut doesn't work.
That's right.
The happy juice called serotonin is the majority of it, the greatest majority of it, 80% of it is produced in the intestinal tract, not in the brain, but it affects the brain. So when you've got a bad gut and your gut's inflamed and it's toxic, guess what you're not going to produce? Mm-hmm. Yep, and it's got to be cleaned out.
That's right. That's right. So, again, we get back to the same thing. That's our exit pathway for junk that our body doesn't need. That's primarily what it does. It accumulates the things. All the really good nutrients have been absorbed in the small intestine. A few other things are produced by bacteria and absorbed in the large intestine, but mostly we recycle the water. That's our original recycling unit. And what's left is residue that is not effective and not useful to the body, and it needs to get out of there. It is not supposed to sit around there for 4, 5, or 6 days, and there are some people who have a movement once a week.
Now, we're talking about biochemistry, and what people don't realize is that biochemistry is controlled. The king is the nervous system. Mm-hmm. And if the neurological pathways aren't working, all the stuff that we're talking about is worthless. And there's an area of the spine called the splanchnic nerves. That's part of the middle of the back, thoracic area where the rib cage is. The lower portion of that is where it comes from. And if those areas are pinched, we got a problem.
Dr. Tom Roselle live on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. My guest is Sue Roselle. We're broadcasting from Orlando, Florida at the International College of Applied Kinesiology annual meeting, a think tank extraordinaire. It's amazing what's been going on here for the last few days and which will continue. And we will be in office on Monday. If you'd like to re-listen to this program, go to RoselleRadio.com or go to WMAL.com. And either way you can find it, but we have all of our back programs on Roselle Radio. Go to RoselleCare.com. That's RoselleCare.com. Write us a note, and we'll get back to you. Also can register for Ageless Health 2011, September the 17th, and you can save 15% right now if you get it done. You got to do it by June 20th. Sue, you got a couple things that you want to talk about before we have to close off here.
Just before the break, we talked about those people, sadly, who only have one movement a week.
Yes.
Or somewhere in that vicinity. Actually, the transit time should be somewhere between 18 and 36 hours. 18 in other countries, 36 in this country.
Yeah, no kidding. We're all full of it. I mean, we have problems, constipation, sorry.
If you don't have a problem with diverticulosis, which is the pockets that form in the intestinal tract, there's a little quick test you can do to see how long it takes for things to pass through.
How's that?
You take about a tablespoon or a teaspoon and a half of either white sesame seeds or uncooked millet, just the uncooked form. Don't chew it up. Just swallow it. And record the time that you swallowed it, and then watch your stool for the next few days and see how long it takes until you no longer see those little white specks.
So how long should before we see the bird feed come through?
Bird feed should start coming through in about 12 to 18 hours.
Whoa.
Okay?
Guess that doesn't happen too well.
It should be pretty much done within 24 to 36 hours. So that kind of gives you the framework of where it should be. If you don't see anything for a couple of days, then you know you've got 2 days' worth of stuff in you.
Well, you know what? The majority of the population are going to starve the birds because they're going to stay in there a whole lot longer, and it's not a good thing. Matter of fact, if we threw seeds of any kind down most intestinal tracts, they would probably be able to germinate before they got out.
Oh, that's bad.
It is, but that's
now
true.
The acid will kill him.
I know. Well, sometimes. I have a patient that I remembered going back some years ago that she had a bowel movement every 2 weeks.
I know.
It's like, oh my God, no wonder your skin was so brown.
Mm-hmm. That's bad.
Let's wrap this up. I think we're getting carried away here.
Bottom line here, if you have diarrhea, you've got a problem. If you've got constipation, you've got a problem. And if you don't fix those problems before you do anything else, no matter how good you are, no matter how much you try to make everything else work, you're still going to have problems.
Yeah, it's amazing. The intestinal tract is about your life, and if you're not willing to clean that up and quit polluting it and heal it the way it's meant to be healed, you're going to suffer ongoingly. The problems that you have will continue to be chronic. They're never going to go away. They're going to just potentially get worse. You'll end up with all kinds of cancers throughout your body. You're going to end up with degenerative disease that is totally avoidable and reversible if you're willing to do what it takes. It's one of those things that you have to pay attention. We're here every Sunday at 12 noon bringing you the most up-to-date information on integrative healthcare. This is where you tune in, right here on WMAL, every Sunday at 12 noon. See you next week. This is Dr. Tom Roselle. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.